Now is an exciting time in terms of where to choose to birth your baby, and we understand it's a really confusing time. However, your doctor and midwife are here to support you in terms of how you access care that's based on your needs and your personalised wishes. We have options to deliver in our high-risk birthing unit on the delivery suite, in our Newcastle birthing centre for low-risk care, and also at home under the care of your community midwife. There's some big decisions to make, but the team are here to support you along the way.
I definitely think people need to be more aware that they have a choice for where they would like to give birth. I think a lot of people are unaware that there are options that exist, and they just believe you turn up at maternity unit and you have a baby. There are plenty of options, and it's definitely worth looking into them before you arrive at the hospital so that you know what you're going into, and you're also aware that things may change and your birthplace may end up changing in labour, and being aware that that's a possibility.
You can give birth where you want, more or less. You can have your baby at home, you can have your baby on delivery suite, or you can have your baby at the birth centre. Sometimes people get confused by delivery suite and the birth centre. Birth centre is an alongside unit, which means it's run by midwives, but we are alongside the delivery suite, which has got doctors on as well.
The birthing centre birthing suites are really nice in that a lot of the medical equipment that is in the room is hidden away, so it looks just like a wardrobe, it looks really comfortable.
It's a home from home-like environment, it's really beautifully decorated, it's very large rooms, there are birthing pools in 5 rooms, and we make it feel as much of a comfortable environment as we possibly can.
You're welcome to bring your own things in, so your own music, your own lights. We've also got a range of aids to help you get in different positions. Really, we're just about making you as comfortable as possible.
On the birthing centre, your partners can stay overnight. There is more room, and every room is a private room.
They often have double beds that pull out from the sofa, so that was definitely a more comfortable choice there.
It's open visiting, so they can be here all the time.
The rooms on delivery suite are equipped with a continuous CTG monitor and a sonocaid to listen to baby's heart rate, whereas the rooms on the birthing centre have just a sonocaid to listen to baby's heart rate, as if you were to need continuous monitoring, you would be transferred upstairs. It's a place where you can get further pain relief, like your epidurals, or if you're just wanting more monitoring of baby, that's what we can offer up there.
So on the delivery suite, the pain relief options include gas and air, pethidine, and we have access to a 24-hour anaesthetist who can provide epidural pain relief during labour. If you have an induction of labour, you will receive your pregnancy care on the delivery suite and ongoing care on the postnatal ward.
There's television, so you can kind of just chill out and watch telly, and we dim the lights as much as we can. It's up to you basically how you'd kind of want to modify your room to make you feel more comfortable.
Immediately after birth, you will be offered some tea and toast, change the sheets and make sure the room is nice and relaxed, and feeding support is given to you. Babies will usually be offered the intramuscular vitamin K injection. This is offered to all babies. This will be done during the period on delivery suite before we would be transferring you to the ward.
The postnatal ward has a mixture of 4-bedded bays and cubicles with ensuite facilities. So food is available after labour. There's a canteen on site and a coffee shop downstairs. Some people will be referred by their community midwife when they first book their pregnancy due to additional complications such as medical conditions or problems in a previous pregnancy, such as a previous caesarean section. Those women will be classed as high risk and will have consultant-led antenatal care. So some people choose to have a planned caesarean section for delivery, and other women will need a procedure in theatre performed as an emergency, and that can happen due to concerns during labour about baby's well-being, or due to lack of progress in labour, or for other conditions. If you need to go to theatre, you'll be looked after jointly by the obstetric team and the anaesthetist. The benefit of delivering in a very large hospital is that we have access to a lot of specialists very quickly, and even the most complex of medical conditions can be looked after here. So here in Newcastle we have the ability to look after babies at very early gestations due to having the neonatal intensive care unit, which provides care for these babies.
We're putting you at the heart of this, and we're trying to provide a personalised care, then that means we're having a supportive conversation all the time. It's an ongoing dialogue. You've always got options. So for instance, your labour slows down and we're trying to think, right, what do you want to do next? I will tell you all the options and then you can choose. It's absolutely up to you. No one's more important than you and your baby, and we want you to feel empowered and confident and happy with your care.
Everyone has a choice in where they give birth. You can discuss options with your community midwife. If you are low risk in your pregnancy, you can opt for any of the 3 options. If you are high risk in pregnancy, you can still have those discussions with your midwife, and then if they felt that it needed to be discussed with a doctor, they would refer you for a consultant appointment to make those discussions and make a plan for your birth.
We're all very flexible and highly skilled at looking after women in all scenarios. That's low risk birth settings and high risk birth settings, and we always put your experience at the centre of what we do.
Look over all the information that you can and make sure you feel comfortable with your decision and aware that you have all the knowledge and facts that you need to make it a positive and empowering experience for you.